Welcome to Healthy Living. I'm Dr. Debi Lynes here today with my friend Dr. Gwynn. Good to see you.
Good to see you again.
We've talked quite a bit, and it's good to always have the opportunity to interview you. I'm especially excited to talk to you today because we're going to talk about some robotic surgery. But before we get into that, I would love to share a little bit about your background with our viewers because I know it's wonderful, actually.
So I went to Virginia Tech undergrad, and then I did my medical training in Richmond, Virginia, at Medical College, Virginia.
Okay.
Then I went to Wake Forest University, did my residency.
Are you a Virginia boy?
Native, yeah. I grew up in Martinsville.
Oh, did you really?
Mm-hmm.
Oh, my kids went to UVA, so I know that area very well.
That was, well, UVA is our rival school.
A rival
but
school,
that's okay.
but that's okay. Yes, exactly. One of the things that it's fun for me because I got to talk to Dr. Gwynn a little bit before, and one of the things that's interesting to me about urology, I ask you if the balance of your patients are male or female, and who actually comes to you and for what, just generally.
When we think about urologist in general, urologic surgery, we think about men coming, right?
Yes.
Prostate health, enlarged prostates, those sorts of issues. But actually it's pretty, my practice is probably closer to half female just because of the different types of conditions. Females get kidney stones, vaginal prolapse, other issues like that, incontinence of urine, so we treat all of that.
So I know today we're specifically going to focus on robotic surgery, and if I may ask first, what is robotic surgery and how in the field of urology has it shifted or changed your practice? And third, what kinds of disease process or things do you see where you use that form of technology?
Okay,
that's
so,
a lot of questions.
Yeah, that's a lot. Robotic surgery, the way this came about is everything was traditionally done through an open incision.
Okay.
And that allowed us to get in there, put our hands in, see everything, but many times wasn't quite as meticulous maybe, especially some of the surgical procedures we do in the pelvis, although you know, I can't say we're done badly, it's just there was room for improvement.
Sure.
So then there was laparoscopy where we use smaller instruments to operate from above.
Okay.
So the Da Vinci robotic platform took that a step further to facilitate minimally invasive surgery. Now we can use even smaller instruments to do the procedures. A lot of people may be surprised, it's 10 times the magnification of the human eye. So when I'm looking in the console or into the body, I'm seeing 10 times what my eye would see if I was doing open surgery.
How does that affect you as a physician? I'm sure there has to be an adjustment, but it must be amazing to be able to see anatomically 10 times what you're normally seeing.
Yeah, well, you know, imagine if you're wearing magnifying lenses to do surgery, it would be similar, but you adjust to it fairly quickly, and to be able to see these structures anatomically, to be able to preserve, and it's much more precise. So basically the Da Vinci robotic platform lets you do minimally invasive surgery, and if you can imagine, even in a more minimally invasive way.
So how does it actually work? Obviously a robot is not doing my surgery.
Yeah, I get asked that a lot, is the robot doing my surgery? But no, you go to sleep and I place the tiny 8mm ports in your abdomen.
Okay.
And then we bring what's called the robotic arms connect to that, and then I'll go sit down next to you in a console. The console has you know, all of the controls for me to be able to do the surgery. Everything I do with my fingers is a wristed movement inside the patient.
So you're actually moving okay.
So you do all of that, and basically I do the entire surgery there, and when I'm done I come take the ports out and you go to the recovery room.
I love listening to you talk to it. It's just so very matter of fact. And I'm sitting there in my mind thinking of the precision that assisted surgical, I guess, instrument can help you with. I mean, it's got to be more precise.
Yeah, it's you know, and relate to your question you asked me, you know, I was one of probably the last few lucky surgeons who trained open surgery and did hundreds if not thousands of open surgeries. And then during my residency came in the robotics. And so having done that afterwards in robot, I can tell you there's no comparison to the precision, the operative, really minimal to no blood loss. Your recovery's quicker. You're in the hospital a shorter time. You're back to doing what you want to do much faster using robotic surgery.
Can you talk to me a little bit about what procedures are especially are especially helpful, where the robotics are especially helpful?
So that's an interesting question too, because the first utility of robotic surgery was removal of the prostate.
Wow.
To allow us to get into the pelvis and do a more precise surgery maybe than we could before removing a prostate for cancer. So that one has been the most studied, time tested and done. So number one on the list, I would say, is removal of the prostate for prostate cancer.
So if someone comes in, then they have the options. That might be first line of action for that.
Well, it depends on
a myriad of things.
A lot of factors, but yes, in a patient who's healthy enough to undergo surgery with curable disease, I would argue that it likely is the number one management option in the U.S. today.
Oh wow, I never even realized that. Curable.
Absolutely.
I like that. All right, other procedures.
So other procedures that we'll do, kidney, so anything in the genitourinary system is what I deal with. So that includes your kidneys, so renal masses or tumors of the kidney.
Oh, those are done.
The robotics now allows me to selectively remove these tumors and leave the remainder of the kidney behind. Whereas maybe a decade ago, we would take the whole kidney out. So now we're able to spare your renal function.
Okay.
Tumors that develop within anywhere in the tube that drains the kidney to the bladder.
Okay.
Removal of the bladder.
I was just thinking bladder. That would seem like it would need to be an open surgery, but not so much now.
No, and robotic surgery for removal of the bladder when need be has greatly reduced the morbidity and the mortality of that procedure.
Is that usually a cancer of the bladder, or are there other?
It is. You would normally remove a bladder for cancer, but that's pretty far advanced tumor in the bladder.
Okay.
Other procedures.
Oh, so you actually could go in and with your robotics kind of
take remove the bladder.
Got it.
If need be.
All right. Other procedures.
Another procedure we do a lot, vaginal prolapse.
Okay.
So,
talk me through that. I've heard that term, but what would I be coming to you for? What would I be experiencing?
So you would either come to see us or talk to your doctor about, I feel like I have a bulging, like I'm sitting on a baseball.
Got it.
I have a lot of pressure. I feel like something's coming out.
Okay.
When you come in, we're able to visualize the prolapse, and then one of the gold standard ways to treat that is to, if you think about it, I use this analogy a lot. The vaginal canal is like when you prolapse, is like a sock turning inside out.
Okay.
So I'm actually there taking that sock, pulling it back in, and reconnecting it to the sacral bone.
What causes that, Dr. Gwynn?
Well, that can be genetics.
Got it.
Unfortunately.
The dreaded genetics.
But weight, smoking.
Really?
Multiple vaginal deliveries.
Okay.
Heavy birth weight infants, things like that can cause some trauma to the pelvis earlier on.
Do you advocate, are you an advocate of like pelvic floor exercises? Or are there a lot of things you can teach women to do?
Absolutely.
Because I know incontinence is something that, you hate to talk about, but it is what it is.
Yeah, pelvic floor therapy is definitely useful, has its own benefits, physical therapy, especially if it's a mild case. A lot of times we'll send a female for that, and we have good pelvic floor therapists who can help strengthen it to be able to do your Kegel exercises in a more controlled and better way. However, prolapse, as we talked about,
that's something that
pelvic floor therapy won't make it's weak musculature. You can't
undo that.
Yeah. So each one of these has its role.
So talk to me about how having that disorder and then having you do robotics, tell me about what the patient would experience.
So they're going to come into surgery. Procedure may be an hour and a half long.
Is it an outpatient surgery?
We usually keep you overnight.
Okay, good.
Just to make sure everything's good. But most patients.
That always makes me happy, where I want someone to.
The nice part is, and I tell people this also all the time, I go see you after surgery, people are generally smiling now instead of in agony.
Okay. Oh, wow.
And then the next morning, usually ready to go home by lunchtime. So it's it's definitely better than it used to be.
I love interviewing you. You are very user-friendly. You kind of demystify things, or you allow us to talk about things that maybe are not always comfortable,
Right.
but are
Taboo.
real. Yeah, taboo,
Right.
exactly.
Yeah.
But you make it really easy to share. So I appreciate you coming
You're welcome.
today. I really do appreciate all of you joining us here on Healthy Living. Have a great day.